Hi, it's Dr. Sweeney. Thought I'd do a bit of a longer video to talk about a really important subject to do with mental health. In particular, anxiety and depression. It's such a common presenting feature to me as a GP, and it affects a lot of people. And it's really important, I think, that we talk about it, talk about how we're feeling. Often in life, things can happen and we can start to feel quite stressed. But then if that prolongs, it can lead to anxiety. And anxiety can be a condition whereby people can feel more uneasy, as if something bad's going to happen all the time, and knot in their stomach, butterflies, heart racing, sometimes even sharp chest pains, breathlessness, dizziness, nausea, altered bowel habit. The list is endless, weight change, and if we're under stress and anxiety for so long, it can lead to panic attacks, which are an extreme form of anxiety. And that's really when anxiety reaches its sort of crescendo, its maximum, and we have a release of adrenaline. The heart rate goes up, the respiratory rate goes up, we feel as if everything's closing in around us, and it can make us want to sort of escape. It's a fight or flight reaction. It feels like we want to escape from a place, and it's horrible. It feels like we're going to die, Now, when that goes on for long enough, it can then lead to depression, which is a feeling of feeling withdrawn, losing interest, not wanting to do anything, not wanting to sort of see people or mix with people, and can sometimes even have some thoughts of self-harm and suicide as well. So these are all connected. So it's really important that you do, if you're feeling any of these things, speak to a healthcare professional and get the right advice. There's also lots of online advice available to do with relaxation techniques that can help. Breathing techniques, a technique called progressive muscular relaxation is really helpful to deal with stress and anxiety. But altering your diet can really help, cutting out caffeine, minimizing alcohol, avoiding any other street drugs. Is really important. Exercise is massively important as well. So people that exercise regularly, either just simply walking, swimming or cycling, anything like that helps to get rid of a lot of the adrenaline out of our system and helps us to relax more easily. So self-help information, dietary changes, substances, avoiding substances that can make us feel more unwell. Caffeine is a massive factor as well, particularly in anxiety. So if people drink a lot of caffeine, it can really pump up your nervous system and make it so that you feel like you can't relax. So going decaf is really important. To begin with, people can feel terrible. They can have a real withdrawal headache. But if you keep hydrated through that, within a few days, you'll feel a lot calmer and more balanced. So that is really important to consider too. So overall, it's really important to take note of lifestyle factors. In terms of the psychology of understanding why we feel like this, anxious thoughts are what we call intrusive or automatic negative thoughts. These are often our worst thoughts and fears, things that we'd never want to happen or come true. And they're designed to frighten us, and they're designed to keep the anxiety and depression going. Now, we don't create these thoughts. They're part of the anxiety and depression. This horrible illness makes us have these horrible thoughts. And a big step forward is starting to step back and recognize what we're thinking and how we're feeling, how it makes us feel. So when we can identify these thoughts, if we are feeling anxious, stop, take a breath, and just think, what are we actually thinking about that's making me feel like this? And then once you've identified this, recognizing that actually these thoughts, they're not real, they're not going to become real. Just because you've thought them, don't be upset with yourself, but just try to work on allowing yourself to let them go while you're doing relaxation techniques and while you're talking to people that you trust about things. So identifying these negative thoughts and feelings and trying to let them go and trying to keep yourself present in the moment and relaxed and calm. Doing all these things together can really help to overcome anxiety and depression. There are lots of medication options, psychologists that you can talk to, and even when it's very severe, psychiatry. But please always seek help from a healthcare professional. Until next time, see you soon.